Coming to the next question, the formation of the plaque in early stage can be detected by the answer is a disclosing solution. So what are disclosing agents? Disclosing agents, they are substances that are applied to teeth to help to detect the dental plaque. So they basically color the dental plaque, making it easily visible. So how do the disclosing agent work? So when you apply the disclosing solution to the teeth, they impart color to the soft deposit and the dental plaque. The clean teeth surface do not retain the color, allowing a clear distinction between area with and without plaque. So what is the purpose of disclosing agents? The primary purpose is to help in the detection of the dental plaque. So once the plaque is stained, its location can be easily identified. So this method it is useful for both the dental professional and individual practicing oral hygiene at home. Now what are the disclosing solutions that can be used? We can use this two-tone dye solution. Remember the basic fusion. It is common disclosing agent that we used in modified Quingle-Hane plaque index. So answer would be disclosing agent. Coming to the next question. So these are the key points that you have to remember for your entrance exam. Some questions that have been asked previously in the Neet exam from disclosing solution. Just remember them. Coming to the next question, image based question on implant connection between implant and bone. So the implant connection between implant and the bone, it's named as osseointegration. So what is osseointegration? We denote osseointegration when there is a direct structural and functional connection between the organized living bone and the surface of load bearing implant, that is known as osseointegration. So remember, there won't be any soft tissue interface between the implant and the bone. So that's the osseointegration. So primary goal in implant placement is to achieve an intimate bone to implant connection. So this concept is known as osseointegration. So histologically, it involves the integration of implant with the living bone tissue. So what are the factors we require for predictable osseointegration? The number one is the biocompatible material, that is the implant. The implant material should be compatible with the surrounding tissue to minimize the risk of rejection or any adverse reaction. Second, the surgical procedure should be gentle to minimize the tissue damage, promoting there should be good healing afterwards. The third is the implant placement should be in intimate contact with the bone. So placing the implant in the direct contact with the bone, that would enhance the chances of successful osseointegration. And the last is the immobility of the implant during healing. So the implant should remain immobile relative to the bone during healing phase to facilitate the integration process. So the answer, that is why, is the osseointegration. Coming to next question, the skin lesion associated with ulcerative colitis is? The answer is pyoderma gangrenosum. Well, pyoderma gangrenosum, it is a dermatological condition that is associated with ulcerative colitis, particularly in the adult. So remember the pyoderma gangrenosum, it is an inflammatory skin disorder. There you will see development of painful necrotic ulcers, dead ulcers on the skin. So the relation between the pyodermal gangrenosum and inflammatory bowel disease like the ulcerative colitis, it is known as dermatologic extraintestinal manifestation. So in some patients with the ulcerative colitis, the severity of the skin lesion of the pyoderma gangrenosum, it is closely linked to the severity of the bowel disease. Coming to the next question, the arterial capnography, it is used to measure. Now, what is capnography? Capnography, it is the continuous monitoring of the concentration or partial pressure of carbon dioxide in the respiratory gases. So, arterial capnography, it is used to measure the partial pressure of carbon dioxide. So, arterial capnography measures the partial pressure of carbon dioxide in the arterial blood. Coming to the next question, the school survey done for those who having caries are added to different group. So this belongs to which type of study? The answer is a multi-phase sampling. So imagine you want to conduct a study on the student performance in the school. So in the first phase, you decide to collect the information from all students in school. So after this examination, you identify a subgroup of the students who are struggling academically. So in the second phase, you focus specifically on the subgroup to gather more detailed information like their study and habits or attendance patterns. So this two-phase approach where you first collect information from the entire school and then focus on the specific subgroup, it will be example of multi-phase sampling. What is a multi-stage sampling? So now consider you want to conduct a nationwide study on the health habits. So in the first stage, you decide to select a few states from different region of country. In the second stage, you choose specific cities like Ludhiana, Chandigarh, Delhi, within each selected state. Like in Punjab, you choose Amritsar, Ludhiana, Chandigarh, etc. So in the second stage, you choose the specific cities within each selected state. Finally, in the third stage, you pick the neighborhoods within each cities. So this multi-stage approach involves selecting groups from clusters at each stage, starting from the broader regions and then gradually narrowing down to the specific neighborhoods. So that is a multi-stage sampling. So example is a nationwide health survey where the states, cities and neighborhoods, they are successfully chosen to create a diverse and representative sample. So answer for the MCQ, this MCQ is the multi-phase sampling. Coming to the next question, most common parotid gland tumor is, well, the most common parotid gland tumor is the pleomorphic adenoma. So remember the pleomorphic adenoma, it's the most common benign neoplasm of the salivary gland tumor, including the parotid gland. It occurs, it is more frequent in the major salivary glands. The tumors, they are more commonly in the adults and women and tends to spread lateral to the midline. Other tumors like adenoid cystic carcinoma, acinic cell carcinoma and Warthin tumor, they can also affect the parotid gland, but they are less common and may have different clinical implication. So the most common tumor of the parotid gland tumor is the pleomorphic adenoma. A prosthodontic, while preparing maxillary first molar, put bevel on the palatal cusp. So that is done to provide, the answer is structural durability. So the use of the bevel on the palatal cusp of the maxillary first molar during prosthodontic preparation serves the purpose of providing structural durability. So this bevel, it is, remember, it's, in this case here is the palatal cusp of the maxillary first molar. We generally give it to enhance the strength and durability of the restoration. So the overall goal is to create a preparation that allows for adequate thickness of the restorative material. So the bevel on the palatal cusp contributes to the structural integrity and durability of the prosthodontic restoration. So remember the bevel, it is applied to the functional cusp of the posterior teeth. For maxillary teeth, it is given on the palatal cusp, while for the mandibular teeth, it is placed on the buccal cusp. So this bevel, it helps in conserving more natural tooth structure during the crown preparation. It minimizes the risk of interference between the crown and opposing teeth during biting and chewing. Coming to the next question. To place a preformed metal stainless steel crown onto the tooth without removing the caries and no tooth preparation without local anesthesia. So this technique is known as Hall's technique. Remember the Hall technique, it is a method that is used to manage the carious lesion in the children, and it involves the placing a preformed metal crown, that is the stainless steel crown, onto the tooth without removing the carious tissue. So remember, in the Hall's technique, no caries is removed, no tooth preparation is carried out, no local anesthesia is used. The crown used in Hall's technique, they are preformed and manufactured for the traditional use. They are simply pushed over the tooth, providing an effective seal. So the Hall's technique, it is particularly used in cases where the traditional restorative approach may not be feasible or well tolerated, especially in the pediatric patient. So the answer would be Hall's technique. Coming to the next question, the converging walls aids in the converging wall, especially when they converge occlusally, it contributes to the it contributes to the retention. So in the context of amalgam restoration, the retention foam is mostly provided by the external walls that converge occlusally. So this design would so this design helps in preventing the displacement or removal of the restoration by tipping or the lifting forces. So the converging wall, it helps in creating the necessary retention for the restoration. The next question, site for intravenous greater saphenous vein, it's anterior to medial malleolus. So the great saphenous vein, it arises from the medial side of the dorsal venous arch of the foot, and it ascends anterior to the medial malleolus along the medial side of the leg and thigh, and draining into the femoral vein. So the site for IV access for the greater saphenous vein would be medial to lateral malleolus. Or anterior to the medial malleolus. Coming to the next question, the premaxilla, it develops from, so this premaxilla, it develops from the frontonasal process. So face, it develops from 5 processes which surrounds the primitive mouth. The processes are frontonasal process, maxillary process, and the mandibular process. So maxillary process and mandibular process both are one on the each side. So the primary palate, that is also known as a premaxilla, it develops from the frontonasal process. The secondary palate, it develops from the palatine process of the maxillary processes. So remember that. The next question, a patient with history few years ago presents with progressive restricted mouth opening that could be due to the traumatic myositis ossificans. So what is that? It is a condition where painful areas develop in the muscle or soft tissue following the trauma, such as a single blow to area, muscle tear, or repeated minor trauma. So over a time, these painful area would develop masses of cartilaginous consistency, and within 4 to 7 weeks, a solid mass of bone can be felt over there. So due to that, there would be restricted movement in the affected muscles or the joints. So myositis ossificans, it involves the muscle of face, particularly masseter and temporal muscle. The common site for myositis ossificans, remember, it's the pectoralis major, bicep, and thigh muscle. So in context of patient with a history of trauma and progressive restricted mouth opening, traumatic myositis ossificans, it is likely the explanation. The patient complained of fever and dull throbbing pain in upper right tooth. On examination, the tooth was found to be non-carious. However, halitosis was present. What could be your diagnosis? Well, the answer is chronic maxillary sinusitis. The chronic sinusitis, they have a mild clinical symptoms and can be discovered during the routine examination. There may be discharge of pus into nose and halitosis, that is the bad breath can be present. Acute sinusitis might have more pronounced symptoms, but in chronic cases, the clinical presentation could be there. So here the answer would be chronic maxillary sinusitis. So sometimes headache, fever, or upper tooth ache is present, or there is stuffy sensation on the affected side of face. So these are the features of chronic maxillary sinusitis. Coming to the next question, a patient presented with heparin overdose. Which of following shall be used to overcome it? Well, the antidote for the heparin overdose is protamine sulfate. So protamine sulfate, it is a medication that is used to reverse the effect of heparin. So the recommended dose for protamine is 1 milligram for every 100 intra-unit of heparin, that is it's to neutralize its anticoagulant effect. In case of bleeding due to the heparin overdose, whole blood transfusion may also be indicated to replenish the loss. Coming to the next question, in composite cavity preparation, remaining dentine thickness is 1 mm. After use of calcium hydroxide, what cement is under composite to protect it? The answer is zinc phosphate. So remember, the zinc phosphate cement is chosen as the cement to protect the composite restoration. The use of calcium hydroxide, it acts as a protective layer beneath the zinc phosphate that is recommended. So this combination help to reduce the effect of initial low pH of zinc phosphate cement. The calcium hydroxide, we know it acts as a protective barrier and promotes the formation of secondary dentine. The zinc phosphate cement, when applied over the calcium hydroxide, it helps to remove the harmful effect of its low initial pH on the remaining dentine and the pulp. So the combination of calcium hydroxide and zinc phosphate cement, it is chosen to provide comprehensive protection to the remaining dentine and pulp from potential irritants and low pH effect. Next question, the patient presented with swelling uvula, breathing problems, high grade fever, submandibular swelling, neck swelling, tongue elevation. What would be your diagnosis? Yes, it's a Ludwig angina. So it is a severe, potential life-threatening bacterial infection involving it involves the sublingual, submandibular, and submental spaces in the floor of the mouth. So you will see there would be swelling of the floor of mouth. There can be submandibular swelling. The patient complains of difficulty in breathing. The tongue would be elevated, and you will see a firm indurated swelling. So that can lead and compromise the airway, leading to the breathing difficulties. So it is a serious condition that a prompt diagnosis should be made and intervention should be done to ensure the patient safety. So your diagnosis here would be the Ludwig angina. What is the branch of orthodontics and dentofacial orthopedics? It's the corrective orthodontics. So remember, the branches are preventive orthodontics, interceptive orthodontics, corrective orthodontics, and the surgical orthodontics. Coming to the next question, note a specific feature of Horner syndrome is. Horner syndrome, we know it is a neurological condition that is characterized by disruption in the sympathetic nerve pathway. So the triad is ptosis, there would be drooping of eyelid. Second, there is meiosis, that is constricted pupil, and there is anhidrosis, that means loss or sweating on the affected surface affected side of the face. So the answer would be C, enophthalmos. A 55-year-old male presented with neck swelling along with palpable axillary lymph node radiating to the groin region. What would be the most likely diagnosis? So lymphoma, follicular lymphoma, it is the type of non-Hodgkin lymphoma and it is present with painless swelling in one or the more lymph node. So the common location for the lymph node, they can be neck, armpit or the groin region. So lymphoma, it is characterized by abnormal growth of lymphocytes that are the type of WBCs that lead to formation of tumor in the lymph nodes. So given the age of patient, the presence of neck swelling along with the palpable axillary lymph node that are radiating to the groin region, lymphoma becomes a likely diagnosis. Coming to the next question, a thin layer of film containing desquamated epithelium, leukocytes and microorganisms formed over surface of calculus. It is a materia alba. Materia alba, it's a soft deposit that forms on the tooth surface. It consists of, remember, it consists of desquamated epithelial cells, leukocytes, and mixture of salivary proteins and lipids. So your answer is materia alba. The Remember the pellicle, it is an organic film that is derived mainly from saliva. It initially contains few or no bacteria and it provides a base for attachment of the dental plaque. Plaque is a soft sticky film of bacteria that forms on the tooth that consists of bacteria, their byproducts and the food debris. So in context of question, the correct answer is indeed materia alba, as it specifically referred to the layer of film containing desquamated epithelial, leukocytes and microorganisms over the surface of the calculus. The self-cure and heat cure resin all are true except the answer is former has less monomer than the heat cure. The residual monomer refers to the unreacted monomer units that remain in the polymerized resin material after the curing process. So in a journal, the self cure has higher level of residual monomer compared to heat cure. So this one is the difference, the table between the properties between the heat cure resin and self cure resin and their differences. Remember that for your exam point of view. Which of following image does the represents? It represents the myoepithelial cells. They are the contractile cells that are present between the basal lamina and epithelial cells of the glandular acini in the salivary gland. Coming to the next question, antibiotic recommended for patient who is allergic to penicillin is it's the clindamycin. Now the patient who are allergic to penicillin, clindamycin is recommended as alternative. Clindamycin, remember, it's effective against penicillin producing staphylococci. So in case of penicillin allergy, remember clindamycin is suitable antibiotic option. A 50-year-old lady complaining of increased protrusion of the maxillary incisors and hypercementosis. What test you will done to confirm? Answer is serum alkaline phosphatase. Hypercementosis, we know it's a excessive formation of cementum on the roots of the teeth. It can be associated degree of elevation and the degree of elevation may correlate with the extent of disease. So in the given context, serum alkaline phosphatase is the relevant test to that could be done to assess the possibility of the Paget's disease, especially if the hypercementosis is observed in this case.